All right. Well, good morning, everyone. It's so great to see everybody. Thank you to everybody for being here. You know, on behalf of WVSOM and its Board of Governors, we welcome our distinguished guests to our beautiful campus here and just drop-dead gorgeous Greenbrier Valley. Dr. Gupta, we are so pleased that you're here with us today. We at WVSOM and throughout our entire community appreciate the incredible work you're doing at the national level. On behalf of us, your experience and expertise are truly making a difference here in rural America, you know, and especially here in Greenbrier Valley where, you know, the rubber really meets the road. I am so pleased to see former Senator John Unger serving as senior advisor to the National Office of Drug Control Policy. You know, during his tenure in West Virginia, he was a tireless leader in our state response to illicit the drug epidemic. You know, his work to train and prepare peer recovery support specialists will have a lasting, indelible impact on the lives of individuals with substance use disorder in our state. Thank you, John. As most of you are aware, WVSOM recently celebrated 50 years of serving West Virginia. We're so proud of what we do here. We're a leading producer of physicians for the state, and certainly we've populated the entire rural areas of the state with our grads. But we're more than that. We have a research enterprise, and we're supporting community engagement through our Center for Rural and Community Health to address the social determinants of health. Today, we will be talking about substance use disorder and its impact on our communities, on our children, on our schools. WVSOM has taken a lead in West Virginia to provide innovative, high-quality programs to prevent substance use disorder in future generations. We also provide treatment services in a social service model. We assist in rebuilding lives of those in recovery so that they can again become productive members of society. And we're leading the way on an array of holistic modalities to help people with substance use disorder maintain recovery. You know, some of the ways we're impacting communities are serving, you know, the Attorney General, Dr. Dreama Hill, serving as a public health expert to the State Attorney General's office to ensure implementation and inclusion of abatement planning within the opioid settlement agreements. Staying on the cutting edge to help resolve issues such as the change in prescribing laws for medication-assisted treatment to ensure physicians statewide are aware of the change and then offering continuing medical education to help them meet the requirements. Providing programs through our Center for Rural and Community Health to ensure prevention, care, treatment, and recovery services that are available to those with substance use disorder. Offering a 5-part opioid series to our medical students so that they not only know the appropriate treatments, but that they understand the language of SUD, the appropriate ways to interact with their patients, and I think even more important, the understanding of SUD through the eyes of lived experience. Working with the Robert C. Byrd Clinic, and Scott, it's great to have you with us, to develop and implement clinical programs through the hub and spoke grant model, and a new opportunity to provide insurance assistance to individuals with SUD for treatment and insurance copays, lab costs, and prescription costs. And I'm sure we're going to hear more about the roundtable session about the mobile medication-assisted treatment services. We work closely with our community partners, and so many of you are here today, and I can't, from the bottom of my heart, thank you for what you do. But especially to those in the area of pre- and postnatal care for women with SUD and their children and individuals in recovery homes, as well as preventive interventions through our schools and child care services for individuals with SUD. We partner with our local health department on their harm reduction program by Dr. Hill serving on the Board of Health and facilitating the county-wide community needs assessment process. And finally, we work with our local law enforcement and EMS agencies to collaborate on various initiatives around the Greenbrier Valley area. You know, the core of osteopathic medicine is a person has a mind, body, and spirit. It's a core principle. And we see everybody, every individual, every person is important. And so every individual has the capability of self-regulation, of self-healing, and health maintenance. And it's a responsibility. We just have to provide the circumstances, the attitudes, the access to treatment, care, and recovery to these individuals through substance use, who have substance use disorder, to assist them on their journey. As always, WVSOM is ready and willing to serve. You know, in my view, a medical school is more than a place where people get educated to be a physician. It needs to be a leader in the community to help people become healthier. And that includes people with substance use disorder, to get them into recovery and keep them into recovery. So I so appreciate everybody who's come together today to enter into this discussion. I really look forward to a robust conversation. And now it's my honor to introduce this man, Dr. Rahul Gupta, who is no stranger to West Virginia, who has served West Virginia for many, many years. He was the medical director of the Kanawha-Charleston Department of Health. You know, he was our commissioner of the Bureau of Public Health. For my medical students, he created a health policy clinical rotation experience for medical students in West Virginia so that they could better understand the importance of health policy. And I can't thank you enough for being here today and being a part of this roundtable. And then he went on to serve the March of Dimes and is currently serving as the director of the White House National Office of Drug Control Policy. Dr. Gupta, it is an honor to have you here with us today and to share your expertise. Thank you for your work.
Thank you. Thank you. Thank you, President Nemitz. Dr. Nemitz, your leadership is commendable because the school is moving in such a fast pace under your guidance and your vision, and it is such a great thing. You know, I know that when I began at Kanawha-Charleston Health Department, we started to have students that host students from this school right here. And you know, in my career, I've seen students from medical schools, pharmacy schools, nursing schools, you name it. And I have become such a big fan of this school here because it's community focus of students. It's focused on rural communities, actual people, and how to solve problems on the ground. And student after student that came through, I was so impressed. In fact, even when I'm in Washington and some friends and colleagues ask about their kids, and I always refer them to think about applying to the school right here, because it's a gem in the state and across the country. I'm a big fan of this, so thank you. And I'm really excited to be having to meet with students after this roundtable. So, but I want to thank you. It's so nice to be amongst friends and colleagues that I've often worked with so much in the past. One of those is right here, Dreama. We go way back. And as Dreama was reminding someone yesterday, it was way before even West Virginia, in Tennessee. And those are the relationships that count. And I think we know that right here in West Virginia, but especially at the school, how much the value of relationship it is. And then I'm glad you mentioned osteopathic medicine, because osteopathic medicine is so critical and important, the field, to where we go. At a time when we have such high level of gaps in healthcare, especially in behavioral and mental health, it's so critical that you all think about curricula in addiction medicine. You all think about those areas where people need the most help. I'm going to talk a little bit about what I do in Washington. I'm bringing you here greetings from President Biden and Vice President Harris. What we do is, my office there does is coordinates the $43 billion budget of all drug policy agencies, which is about 19 agencies. So it goes all the way from Department of Health and Human Services, like NIDA, FDA, SAMHSA, CDC, but also other departments like DEA, Department of Justice at large, Department of Defense, Commerce, and others, and education as well. So the idea here for the office by Congress is to create the president's drug control strategy every 2 years, and then implement it through these 19 federal agencies through the budget angle. And money talks, as you know. So it's one of the few agencies where you get to make policies and then implement it with the hammer of the budget, which is good, because never before has this been more important for people of the United States, and certainly people in West Virginia. We know we've lost over 1,400 people here, right here, West Virginians last year. That's not acceptable to President Biden. It's not acceptable to me. And that's the reason, if you see, in this administration, we've sent $15 billion to West Virginia already, just from HHS in this administration. So, over $8,000 per person across the state. It's important because not when only you're dealing with pandemics, but you're also dealing with so much overdoses and non-fatal overdoses and addiction, to try to expand care and provide the help. Now, we have telemedicine. So you're able to reach the far reaches of the hollers in West Virginia, where you can connect with people at their homes when and where they want treatment. Also, we've removed the X waiver. What that means for a lot of our students is, it was the extra license you need to get beyond the DEA license to be able to prescribe things like Suboxone. Now you don't have to do that. Just by that one action that the President signed into law, we've gone from 129,000 prescribers to 2 million prescribers for treatment with MAT, like Suboxone. We've also surging naloxone. Naloxone is a very important antidote when somebody's overdosing. And 7 out of 10 people of the 109,000 are dying because of fentanyl or drugs like fentanyl. That means that they're dying of opioid overdose, and if there's naloxone available, you could save that life, because you can't treat dead people. So this summer, naloxone is going to be available over the counter in pharmacies right next to Motrin and Tylenol. And the reason for that is because it has to become more accessible to people to be able to get it. We're also sending unprecedented resources, money, to states to be able to purchase, so people don't have to worry about the cost of naloxone. This is important because one of the other things is behind the walls. There's any given day 2 million people that are incarcerated in this country. And 60 to 80% of them have at least one diagnosis of addiction. Think about that. We figured out several decades ago that the way to fix addiction is to put people in prison. And obviously that hasn't worked. So we've now released CMS guidance for states like West Virginia to apply, where you can turn on Medicaid for 90 days before discharge from prison or jail. What that means is people who don't have insurance gets turned off when they're incarcerated, can now get Medicaid and be on Medicaid and get treatment for diseases like diabetes, hypertension, heart disease, but also addiction, mental health, 90 days before they're leaving, and then they can continue with you in the community to take care of them. So the school should really look at that, because if the state doesn't apply for that waiver, you're not going to benefit from it. But if it does, it's going to save cost, it's going to get people to not be reincarcerated or die of overdose when they're released, and contribute to the society in terms of economics, in a time where we have more jobs than we have people in the state right now. So it's one thing to tout jobs, I understand that, but you got to get bodies to do those jobs. and they're just not going to magically appear. We have to work hard to put policies in place that support West Virginians to stay in West Virginia, and this is one of those things. I think as for students, I'll say, doing a remarkable job for naloxone training and things like that. I think we need to continue. We're even at White House. We have a great class of interns. By the way, that's a soft plug. Whenever you're interested, we have a paid internship at the White House in various offices. Think about that, applying to that. But we do training in CPR, but also naloxone. We look at all this as life-saving trainings. What that means is, just like a defibrillator doesn't cause heart attacks, naloxone doesn't enable people to use drugs. So it's really important to continue to do more trainings in communities and get people trained up so they can feel comfortable and remove the stigma out of what's very hard. So I'll stop there. I'm looking forward to our conversation. Once again, thank you, President Emmons, for having us here, and thank you.
Okay, so I'll take over now. I want to remind everybody that we are live streaming, so welcome everybody who's watching us from all over the country. And if you have questions, while we will not get to them today, you can put them in your chat, and we will make sure that Dr. Gupta's office gets those questions or thoughts that you have. So thank you for being here. A logistical thing is right before we go to our student brunch that we're having, we really do, as soon as we finish the roundtable, we want all the students over there in front of that screen so that we can get pictures with Dr. Gupta while he's here with the students. So today what we're going to do, I think that Greenbrier County and the Greenbrier Valley area, we have one of the most robust and best built systems. Our community infrastructure is strong, our partnerships are strong, which is evidenced by everybody here at the table. And so we wanted Dr. Gupta to see that. What does it look like when you have a community that works together? We still need resources, we still have challenges, and we want him to hear that today. So I'm going to throw out some questions, and I'll probably call on the first person to talk, and then we'll, but feel free, this is your meeting with Dr. Gupta, so if you have something that you feel like adds to that. But what I want to talk about first is what works, what is really working, and how do we sustain that? What do we need as far as resources and things to sustain the work that we do? So I think that I will start with Jay and Andrew over here, because we know that our recovery home system is working, and how that works. If you could talk a little bit about that, but some of the things that we need to keep that sustained, expand it.
Thank you, and thank you, Dr. Gupta, for being here. I think speaking on the recovery side of the house, where Andrew and I work predominantly, what works for us is that there's a really good vertical integration all the way down the continuum of care, from treatment through recovery into long-term or stable recovery, because it takes 5 years really to get someone to that point where their relapse risk rate drops to 15%. And that's always kind of been the focus. Some of the things that work really well is our cooperation with the School of Osteopathic Medicine and some of the partnerships we're building in the local communities. And I think some of the challenges or roadblocks that we face, and I think anybody here can attest to that, is that transportation and sustainable housing are two of the greatest barriers that we face. The availability of housing is growing. The availability to sustain that housing is a challenge. So I think those are the two things that I would speak to the most, particularly in rural southern West Virginia, where connecting the dots involves a much greater geographic distance.
Thank you.
I was just going to say thank you, Jay, and remind people to introduce yourselves, because the people said that's Jay Phillips. He's with Seed Sowers. I'm sorry, Dr. Gupta, go ahead.
Thank you, Jay Phillips. And you're right. I want to make a point about that. You're exactly correct. I've spent time traveling across the country last 18 months in the job, and the number one thing that comes across is housing. And the importance of that housing. That's one thing that I probably underestimated the importance of. So we're working with council, Interagency Council on Homelessness, the White House. We're working with HUD and other agencies to see what more can be done. Transportation, you're exactly right. We often live in transportation deserts. I'll quickly tell you, I was in Baltimore, and I was talking to a group of women at a place where anyone can walk in and get the help. And they actually do rounds, and they were mentioning how they went to the street corner, and they talked to a drug dealer, actually. And they said, why do you do this? He said, I've got loans to pay. I have bills I have to pay. That's why I do it. Okay. Come back, say, they work hard. They said, we've got your job. Would you want to take a job instead? I said, yeah, I'll take a job. And they work hard to get him a job. Several months later, they find he's back drug dealing at the corner. I said, well, what happened? He's like, well, what happened was my Uber and Lyft bills were more than the job was paying me to get to work every day. Because he lived in the transportation desert in Baltimore. And so I'm back. So these things are so complicated in a way that we really have to build infrastructure for housing, transportation, food security, childcare, and those things. So thank you for raising that important piece.
And if I could throw one more thing out there, I don't want to take too much time, but there is one other program that I would be remiss if I didn't mention that I'm very fortunate to be a part of, funded by the Appalachian Regional Commission, called the Communities of Healing Program, that incorporates housing, transportation, and vocational training and employment opportunities. So we're addressing substance use disorder both at the individual level through the clients that we serve, but we're also training employers on how to navigate the challenges of working with people in recovery in their businesses as they grow them. And I think more focus on that community-based integration would be really powerful.
So I'm writing it down because, as you may know, you have your own West Virginian as co-chair of the ARC in Gail Manchin. And in fact, the relationship, here's how relationships work. We had a meeting initially with her team, and they're part of our drug control budget agency. So we're able to do a lot more together. So I'm writing this down because we're going to be able to, I'll take this back, and we'll see. We'll definitely want to do something about it.
And Tamara, I was wondering if you would talk about, because you have a very successful program, and we've already mentioned moms and babies. So could you tell Dr. Gupta about your program?
Absolutely. Hi, my name is Tamara Asbury.
Give her a microphone,
Program
please.
Director.
Hello. For the Drug-Free Moms and Babies program here in the Greenbrier Valley, we started in 2012 with 4 sites, and now we have a program around all the delivering hospitals in West Virginia. It is a comprehensive, integrated, holistic treatment approach to helping moms who are pregnant have healthier outcomes for her and baby and their families.
And how much success have you had with that? What have you reduced the?
In 2012, an umbilical cord study was conducted here at our local hospital, averaging 19% of babies that had at least one illicit drug in their cord. Within a year, we dropped that incidence to over half, and now we linger around averaging 6%.
And Bridget, Dr. Morrison, could you talk about, you or Nikki, talk about harm reduction? We have a very successful harm reduction program in Greenbrier County.
Yeah, so our harm reduction program is very busy. In fact, it per capita is pretty much the busiest in the state. It was much busier, and the legislative actions last year hurt us in many respects with the identification and more regulations. And so as a result, a lot of the harm reduction, in fact, most throughout the state shut down. And so we continue, it's our goal. This is a huge problem in our area, and we continue forward. Talking about our strengths, partnership is very evident if you come to one of our harm reduction. We have a ton of volunteers, we have peer recovery, we have a relationship with Seneca Mental Health with their truck on station that we can get any of them immediately connected with telemedicine. And the churches bring food and clothing and you name it. You'll find that a large portion, in fact most of our participants are homeless or couch surfers. So getting back to what you were saying, that is a huge problem with having some sort of temporary housing, and then of course long-term affordable housing. Transportation's a huge issue, and overall, it's very successful. We definitely are always looking at our budget because it's very costly, and the naloxone that we hand out on any given basis, we're running short or low. But overall, I'm going to let Nikki speak here, but overall, it's pretty successful, and it's an eye-opener for anyone to come and participate and be there and present during our harm reduction days.
Hi, I'm Nikki. I'm the administrator at Greenboro County Health Department. I don't have a lot more to say. The legislation, I know that surely has hurt us, though. We would like to do some mobile sites, but we have to apply for licensure for each of those mobile sites, and that's $500 each. So, the funding is going to be I don't want to say the death of us, but to be able to get out in the community where we need to be, we need to sustain that funding or increase that funding.
So I just want to mention a couple of things on the harm reduction program, which is, when I went to the White House, one of the things we never saw happening as commissioner or as local health department person, that there were no model state laws. So what happens is states make up, the best they can, or sometimes not less than the best they can. And so we started to put in place some state model laws that states can adapt, literally the whole printout of laws that they can fill in the blanks and do, all evidence-based, written by comprehensive processes. One of those is on student service programs. And that's important because the federal government, for the first time in history, has adopted harm reduction as a federal policy. And so naloxone, student service programs, and drug checking, that includes fentanyl test strips and xylazine test strips, are part of the federal policy. Oftentimes, policy can be just about talk, but we're putting money behind it, real money, so talk about budget. The president has proposed this budget $500 million for harm reduction programs. That's $500 million. That's $100 million over last year. So it's important that we have student service programs, drug checking, and naloxone to the level of where it helps people, it saves lives, and saves money. So that would be really important. The other thing I just want to mention also is internally we're looking at how do we figure out the funding mechanisms behind harm reduction programs so that you could have that as a reimbursable service. So that's another piece. So I know we go from fundraising to figure out how to run these, but we are looking at developing a sustainable funding system for that. And then drug-free moms programs, moms, babies. I think, Cameron, one of the greatest things that I think you probably also, I'm proud of because I'm a big fan of it, is that it started out as a foundation program and now it's funded through SAMHSA. And this is exactly a model that the country needs to see and learn from. So I'm always touting it, going from 4 sites to 19 sites across state, and the great work it does in maternal health. Thank you for that.
And Jennifer, could you talk a little bit about what you're doing around? Jennifer Crane is our collegiate peer recovery support specialist.
Sure. So I want to talk about naloxone since we're already talking about that. I do a lot of that training on campus with the students when they first come on during orientation. So it's being done here on campus with faculty and staff as well as the students, as well as out in the community. I do want to share a couple of things that I would love to see happen here in our community and throughout the state. What I've seen is a lot of rural communities. We're unable to get naloxone to them a lot of times. And those are the communities that I'm trying to hit the hardest right now. Rennick Community Center has been amazing with doing trainings there. But other states have naloxone vending machines. And I would love to see those somehow being put into our rural communities because it's needed While we're doing trainings, there's people living in abandoned homes. They aren't getting naloxone. And I'll share that my little brother passed away in an abandoned drug house. If he would have had naloxone, if those with him would have had naloxone, he could very possible be alive today. So that's something that's close to my heart, and that's what I'm trying to get more done, are these trainings and naloxone in the hands that may not otherwise get it if we do not go meet them where they're at. I'm very thankful for this opportunity. I'll speak of recovery ally training that's being done in our communities. That's very important because not everyone yet has been affected by substance use disorder. And it takes a community to change communities. And that's reaching out and learning how to become allies for those that are dealing with substance use disorder and their families.
Jennifer, thank you again. Sorry to hear about your loss of your brother, but what you're doing is you're making the best of it.
Thank you.
We have asked states to put naloxone distribution plans to submit to SAMHSA as a condition to get funding. We would really, both, you could connect with us. We have folks here from my office. We can encourage that to state of West Virginia. But we would also like you to encourage them to put these type of ideas into the plan so that they can be funded. So what we're trying to do now, as opposed to just giving out funding, is requiring states or suggesting to states that they provide a naloxone acquisition and distribution plan, including searching naloxone, in order to get the funding for it and execute it that way. That's a change. So hopefully that state of West Virginia will do that and add the, however, the needs of the community, because it's all about not the state, having worked it, it's about what the needs of the community are and be able to take that and get the funds for that. So thank you, and thank you for your work.
Thank you.
I want to shift a little bit to the clinical side of things. I'm going to ask Dr. Calloway to talk a little bit about the work that she's doing, and then I wanted Scott and Judy to talk about what's going on at the clinic, and Marcy to talk about the Seneca. So go ahead, Catherine, if you want.
There we go. Hey, I'm Dr. Catherine Calloway, provider in the Charleston area, and my background was in both international and community health settings and chronic disease management. And one of the really neat things we had an opportunity to do with the SOARS grant over the past few years was we were able to use a SOARS grant to create a multi-tiered program through an FQHC with their MAT program in coordination with them. And what it allowed us to do was part of that funding was for non-pharmacologic pain management, where those patients who had been in the program successfully up to 3 months were able to engage in OMT, that was covered, massage therapy, acupuncture, equine therapy. And the equine therapy wasn't just for the patients, but it was also for the patients' families and children. Then there was a dental program that was connected to that, which was a big issue for a lot of our patients coming through there. And at that stage, they're also starting to get back into the workforce and apply for workforce. Additionally to that was a huge nutritional component, which nutrition was on the bottom level for so many of these people at a period of time, but became so much more important in their recovery process, even thinking about the clinical management of their symptoms during that first 3 months, and then from the 3 to 6 month mark. So we partnered with a agricultural co-op who allowed us to bring in fresh farm produce, eggs, meat as well. And we had a local person who was very passionate about this, who volunteered her time. She owned 2 different restaurants, and she would come in once a week on a specific day when the produce was delivered. She would do a cooking class for them. She would, using the produce that was there that day, she would have meals for them to take home. And it was just a time of connectedness and caring and nurturing that was very different from anything that they were experiencing otherwise. Additionally to that, that same person created, we had a open cooler at this place that had prepared meals. We had bags that were non-refrigerated meals that people who were homeless could come in and take, who were coming in for part of their care. Also meals that they were able to take for reheating purposes or not reheating purposes. And that was something that was just so well received by them. So the combination of, a lot of these things we're providing for them was just giving them a sense of humanity and dignity and respect and nurturing that they had not really experienced up to this point. The other thing that helped them do was adherence to the program itself. They looked forward to coming in a different way than other MAT programs that were more siloed for just MAT. So we found it was a pilot program, and we found it to be incredibly successful. Again, one of the barriers to a lot of the things we had was transportation. So, we tried to tweak that within ourselves, and a lot of the staff even just reaching out, picking people up, transporting them to the equine therapy. So that was one thing. But it was a really rich program that we had for a period of time with source funds. And again, it went back to partnerships, really meaningful partnerships where we knew each other so well in the community that we could take those funds and maximize on our resources with the people who were ready to do, right, and really ready to just plug in and do it instead of having more meetings to figure out what to do with the funds or more meetings to figure out, well, who's going to be doing this and who's going to be. They just did it, and we just did it, and it was really effective. Very well received.
Yeah.
So.
Oh, that's great. I actually visited West Side Charles Health Right yesterday, and they had a very similar, not all the components, but they have a similar program there, which just reminded me of the great work that you were just mentioning.
And actually, we work very closely with the partners at Health Right in our community now to try and to merge a lot of the things we did with that pilot program with what they're doing. They are an incredible asset to our community. They are doers. Yes.
They are, and that program, just so you know, it was SOR. It came through WVSOM, and we did the same thing here. And then we did Catherine was at Cabin Creek at the time, and so that was our pilot spot up there. And so we worked with then also Health Right as a partner in that. So we all, it's incredible what you can do if you just reach out. I've never been. You've been in West Virginia, you pull out a table and ask people to come and talk about a situation. And they come and talk about it. People want to do the work. So anyway, Scott, could you and Judy want to talk a little bit about what's going on over at Robert C. Byrd?
So good morning. I'm Scott Mitchell. I'm the CEO at the Robert C. Byrd Clinic. It's located here on the campus of the O School. We serve a large service area here, not only clinical, but we're also a clinical rotation site for students from the school here, plus we have continuity clinics for a couple of residency programs as well. And we do roughly 50,000 encounters a year here, and we've seen the need for services for substance use disorder. You've heard quite a few people mention transportation as an issue. So not too long ago, we purchased a mobile clinic that has 2 exam rooms, has the ability to also do telehealth capability. We've recently hired a provider that is going to be taking the mobile clinic out to do MAT services. We're also going to be providing hepatitis C treatment program as well as part of that, and using that as a way to try to get out into these underserved and remote communities to help provide that care in those communities that really need it. We're still early in the process, but we have been working on the SOR program as well, and I'll turn it over to Judy and let her talk a little bit about what we're doing with that program.
I'm Judy Kohler. I'm the program manager for the SOR program at excuse me, at Robert C. Byrd Clinic, and we currently work with 188 individuals who are seeking, or who are in a medication-assisted program. We work to provide them with supportive services as well. A large number of the issues that they report to us through our GIPRAs, which you know what a GIPRA is. It's a government reporting tool. Dental services is another large request. And as we know, when people go to try to obtain employment and things like that, or just go anywhere, people have that negative impression of these folks who really need some dental care. So that's something I'd like to find a way to get to these folks a little easier. I won't go over transportation, housing. Those are always things that we need to do. And we also utilize peer support services for the folks in the treatment. We partner with Tamron and Marcy and other folks. We also provide services in Raleigh County as well with the WIN West Virginia program.
Okay, and Marcy, when you're telling us all that, we have so many challenges too, and I'm afraid that we are not going to get to those. So could you mention some of the challenges too? Because I know you see a lot of it at Seneca, being our sort of base of operations. I know when I first came here, Seneca was almost the only game in town. I mean, we had a few people going, but Seneca has been a great partner with all of us here at the table. So could you talk a little bit about that?
I can. Thank you. I'm Marcy Vaughn with Seneca Health Services. And, you know, it is a great collaboration in this community. And from early identification with harm reduction, we are able to provide the detox and treatment services for individuals that have substance use disorders. The residential treatment services could be a bit longer. You know, we're lucky if we get 60 days. And really, at the end of the 60 days, the biggest transformation that we see in folks is in their physical health. You know, they're eating healthy, they're getting rest. You know, they have a safe place that they're at. So, and a barrier, I think, for us is being able to have them in those 3531 residential treatment programs a little longer. And then the next step is our partners with Seed Sower and God's Way Home. We need more recovery places that can foster vocational training. Seed Sowers and God's Way Home, they work a lot with the food service industry, but we need vocational schools that train in electricians and plumbers and a whole variety of jobs so that when folks are clean, they have motivation to stay. So that's a huge issue for us. Another is many of the individuals that we have experienced some legal difficulties, and employers have problems hiring individuals that have legal charges. So some type of system that is set up so that those can be expunged and they don't follow them around and prevent them from getting employment that can help them sustain their substance-free life. That would be particularly important as well.
I just want to thank you. You brought up a very important topic that often doesn't get brought up in these conversations, which is the barriers people face, especially for things that sticks around. For example, you know, marijuana possession is one of those things as an example. And what happens basically, even if people are not incarcerated, that conviction carries with you all life. So you can't get a job, you can't get education, you can't get loans, you can't get any welfare, none of that. You can't even sit in jury duty. And that's important. And I mean, that's one of the reasons that we're trying to work on deflection laws. So when people have mental health problems or substance use problems, rather than incarcerating, let's figure out how to solve that problem first and foremost and get them the help. And that's also the intent with which President Biden issued pardons for simple possession of marijuana last fall and asked state governors to do the same. And I know so many states around the country, West Virginia not being one of them, has done that already. because that has changed people's lives when that happens. So those are exactly the point you're bringing up, and I think it's an important point to note that for West Virginians to be able to succeed, West Virginians have to be given an opportunity to succeed. And sometimes that happens, and sometimes, unfortunately, it doesn't for so many reasons. Thank you.
So Jenna, I was wondering if you could talk about the programs, you and Juliana, because Juliana works with all our students in our opioid series. I wanted you to talk about that. But Jenna, if you could just talk about some of the programs that are going on here at the school, since you are over the state opioid response programs.
Yeah. And real quick, just to hop on the barrier train, when it comes to state opioid response and everything that you've heard here today, sustainability. I think that's a huge one. You know, every year we do submit a sustainability plan. But these recovery programs, you know, we can help them year to year, but we need to know that they're going to continue to have that help. But we have ancillary services, we have direct treatment services. Previously, we did a behavioral health workforce plan. You touched on the, you know, the lack of providers. And again, you know, the things that we see work, we continue into the next year's SOAR plan. But just sustaining some of those, you know, sometimes we have great ideas. You know, it's kind of hurry up and wait, and by the time it gets off the ground, we're flat on the, you know, floor again. But I'm trying to think of what we have exactly going on this year. We do work with a neonatal abstinence syndrome program, so we are trying to take that so for example, Jay has a prenatal and parenting women house, so we're trying to take these services to the people that need them for those transportation issues that we've talked about. But I'll let Juliana talk a little bit about some of the things we've done in the past with this as well.
Great, thank you.
So I'm Juliana Quick, and I'm a licensed professional counselor, and I work with the students here, and one of my roles is I am an advisor for the Neuropsych Club, and I think we have some of the members of that club here today. And so back in 2017, when I was meeting with the club members, one of the things that we really brainstormed and what they wanted to bring to campus was an opioid educational series that would help to augment what they were already learning in the curriculum. And so they wanted to bring in community leaders, healthcare providers, first responders, and also people that were in recovery to learn from them and to hear their experiences to inform their practice as future physicians. And I've been really proud of the students. The students have, we initially started this with working closely with the CRCH, but the students have taken over. And so Deanna Morrow, I think she was hoping to be here today. She's the club president, as well as exec members from the club. We have expanded the series not just to focus on opioid use disorder, but substance use disorder. And we had Jennifer Crane come this year and do an allied training for the students. And we've looked at how is this changing students' knowledge as well as their perceptions. And one of the cool things that we saw in the data was it was not only increasing knowledge, but it was actually reducing stigma, and that we had students talk about, I really had some preconceived assumptions about what substance use disorder looked like and the people that were affected. And that has completely been flipped on its head, and that will inform me as a future physician. So really proud of the students for carrying on that series, and it's a wonderful series.
It's amazing. That's exactly the kind of work we need for our future generations, because, we see that with young physicians have a lot less stigma than the older physicians, even the providers from perspective. So we've got to keep working on it, so thank you for that. Thanks.
And one thing about that program is too, you don't often get something that's so interesting to students that 150 students show up for 5 different sessions. But that's how important that program is to the students themselves. So we have great attendance there. So to round us out, because we do just have just a few more minutes, but I wanted to talk about 2 innovative things that are going on in our community. One is with Marvel and Sally and Workforce, and the other is Shea Huffman and Healing Home. So just a couple minutes, ladies, but if you could talk about that.
Hi, I'm retired from the Center for Rural and Community Health, but WVSOM continues to support my work in community engagement in the Meta River Valley. This is a region that has been hit really hard. There were 2 pill mills right along Route 60 going through the community. And working in collaboration with a group of nonprofits, Andrew Bales and God's Way Home being one of them, and then also with Scott Mitchell, we were given, by the Board of Education, a former Rupert Elementary campus after the flood hit. And we are seeing this as an opportunity to build region-wide hope and resiliency. So we've developed an early childhood learning center in the early childhood buildings there. We've hired 20 people from within the community, and we are now offering childcare services in what was a childcare desert. And working in partnership is really key out there, and the whole idea of resiliency and allowing people to tell their stories is something that we're beginning to understand is a big part of changing the narrative in the rebranding of a region that was really full of health inequities and people that didn't feel like they had a chance to better their lives. We're working to provide opportunities and resources and services, and then allowing them to also tell their stories and put accent those stories of resiliency so we can kind of rebrand and change the narrative of the region.
Shay?
My name is Shay Huffman. I've been in women's health care for over 4 decades. We just recently started a program. We were gifted a house and 1.5 acres of land right across from the hospital. And the concept of our program is that we have detox, we have rehab, and then women come back into the community without any support. So that's where we come in. We are that network of support. We're considered a community recovery organization. We have started various groups, and one of the things we've found is that as the women come, and we are not just dealing with women in recovery because our communities are integrated with all of us. So our center is open to everyone, but we do have a recovery coach. We have a pediatrician on staff. We have a sustainable agriculture program to get women to start gardening, and the director of that program is looking at not only teaching gardening, but how ways that women can sell the produce. But what I found in our group, we have various support groups, and the women talk to each other. We have grandmothers coming in who have inherited 6 grandchildren. We have women who have never been in recovery themselves, but they have family members who have been. And then the women in recovery themselves. And when they start sharing stories, it starts reducing the stigma that is attached, especially to women. We're working in partnership with Tamron and Drug Free Moms and Babies, and we're looking to work with the whole county. So forming partnerships is a huge part, but, and I will say that working with WVSOM has been, my whole healthcare career has been supported by different programs that they have, and they've helped us actually get started. So I have nothing but gratefulness, and I think this school is very unique in that they really do go out in the community and really provide the true rural health care.
Okay, and Jamie, we hadn't got to call on you, but we talked about community connections and all the, yesterday we had a long conversation, but did you have any comment that you wanted to make?
It's on, wonderful. Dr. Jamie Steins, Community Connections, and I'm also a board member for the Western News Association for Addiction Professionals and Prevention Professionals. We changed our name recently.
And had your conference here on our campus.
Yes, I know, it was wonderful. One of the big things with all the speakers here today and the collaboration, you know, it kind of kicks in exactly the point, and I'm happy I was able to speak in the last area of it, is that collaboration. For the past 20 years, I've had the honor of working not only in behavioral health and substance use treatment, but now as primary prevention as Region 6 Prevention Lead Organization. As my old CEO told me, that just because I'm switching to prevention doesn't mean I'm no longer on that bus. It's just a different seat. And that's the key model when it comes to a lot of this stuff. I've heard a lot of individuals speak about it. We have to come together as a community. We can't sit there and fracture ourselves. It has to be a continued collaboration. We have to diversify our programming to ensure that we're all on that bus. We're all moving in that same direction. So, we have our community folks with our coalitions, working with CATCA, working with the, Office of National Drug Control Policy, or local ODCP, our Reaching Rural programs with the Bureau for Justice, which I'm happy to be a fellow of. By reaching all those individuals, we're able to connect all parts of our community, whether it's transportation, it's linking with our quick response team, getting the overdose numbers down, working with our law enforcement, which now I can tell you, I have never seen a deputy reach out to a social worker. I have somebody that I believe is addicted. What can I do to help them? That has never happened before. The past 5 years, this has been an absolutely phenomenal stigma change. And I just want to keep seeing this move forward, and forward. And I would love to see these prevention methodologies collaborate with, FQHCs or comprehensive centers, and just keep getting these programs going, because we're moving from West Virginia being that ground zero for the pandemic to being that ground zero for making change actually happen on a national level. And I love seeing that stigma float away, so we're not looking at that bad mark anymore within our nation. So,
Thank you.
And I wanted to say a thank you to Dr. Gretchen Lovett is here. She's sitting over there. Give us a wave, Gretchen. I know she's not sitting at the table, but because of Dr. Lovett and her work in addiction, we were able to we qualified to get the state opioid response dollars in the beginning. And she really was a big part of helping us develop our plan. So thank you, Dr. Lovett. Okay, I think this has been wonderful. Thank you all so much for being here. I hope that this shows folks who are listening in that you can take a community and build that infrastructure, and that this model is what we need to do in other communities across our state and across our country. So we thank you so much, Dr. Gupta, for being here, and I'm going to turn it back over to you for some closing remarks.
Well, thank you, Dreama. Thank you for all you do here and at the AG's office. You're making a big difference, I can tell you that. I'm going to take 2 minutes. So first of all, thank you. What thought comes to my mind is hope, partnership, and excellence. You're showing the hope not just to the state, not only in Greenbrier County, the entire state, but the country. And partnerships, remarkable, that we hear about here. We check agendas at the door and actually work. And then a model of excellence that this school is, and it's through that hope and partnership. So thank you for that, and thank you for your leadership, President Emmets. The president often talks about that if we work together, there's nothing that we can't achieve. There's no other reason, no other area that we can work together on. It's more urgently, more powerfully than right now when 109,000 Americans being killed each year, 1 every 5 minutes around the clock. So this is part of President Biden's unity agenda, and it's an important piece, and obviously he appreciates the contribution, the work that's happening right here. I can ascertain that for you. Another thing I want to just mention is that I said we work with a lot of people in defense, so we have a lot of detailees in my office, and a lot of them are high-level officers. Just last week, I was able to go to the promotion of one of them, went from lieutenant colonel to colonel. And one of the people that came to the ceremony was the incoming Joint Chiefs of Staff, the person that's been nominated, General Brown, by President Biden. Part of that is the privilege I've been given is to be able to provide presidential service medals to our officers in service. And by the way, those are the medals that only they and Secret Service and a few select folks can carry and wear across, even in the White House. But another piece of that is, we have what we call challenge coins, the presidential challenge coins. And oftentimes I travel, and it is regardless of the position, but there are leaders with vision in our communities that often become recipients or deserving of the challenge coin. So here, as I've seen throughout my career, but the work that the school does and the leadership of that school that enables that, I want to take this moment to recognize President Emmett, to receive, if you would, we can get up and receive the President's Challenge Coin. Thank you. And the flag of the ONDCP in the front with the eagle and the stamp, and in the back, it has the White House.
Oh, my gosh.
Thank you. Thank you for having us. Go ahead.
Thank you, everyone, for being here. I'd be remiss to say that, you know, really the person who deserves most of the credit is right here, Dr. Hill, but we work together.
She's going to get chocolates, by the way, from President Biden a little bit later.
But thank you so much, Dr. Gupta, and to all of you, again, from the bottom of my heart, thank you for the work that you're doing in our communities. God bless you and continue that good work. To my students, you know, you are the leadership of the future, so I so appreciate you being here. And then to my AVP staff, my marketing and communication staff, to the O Cafe, who's going to provide food, thank you so much for being a part of this. Wow. Pretty cool. Come up and look at it. Thank you.